My name is Guven. In August 2017, I founded EIT Labs, and we are developing a software called Alberta. Before that, I worked 10 years in a company that took care of chronically ill patients. Right now, we have 8 million patients in Germany that have a chronic disease, sometimes light forms of diabetes, sometimes heavy forms of cancer. These patients need treatments worth 7 billion euro. Let's have a look at Walter Müller. He's 82, has cancer, so he needs clinical nutrition and special wound care because of his overall situation. Like him, we have more than 20,000 patients who are already on our platform in Alberta every month. The problem with this is chronic diseases are complex. There are many stakeholders, like doctors, nursing services, home care providers, and family and health insurance. They mostly communicate via paper, telephone, and fax. And they have there is no new employees for them, so they have a resource problem. So that's why we built Alberta, an active supporting system. So what Alberta does is it doesn't only collect electronic anamnesis and documentation of the patient's situation, it automatically plans a therapy for the patient according to his health insurance. After that, it automatically monitors the care and supply of the patient and adjusts and actively suggests better treatments for these patients. So the healthcare professionals can solely rely on Alberta and his recommendations. It works completely offline, so you can be in a big clinic, you can be in a rural area, it always works. And it also connects to existing systems since we have standard APIs. We have a market size of about 300 million euro. With our potential, we can address 30 million of them, and until 2021, we want to have a revenue of 3 million euro. Our potential customers are home care companies, medical supply stores, pharmacies, and big manufacturers. Right now, out of the top 10, we have 2 of them as our first customers. And our business model is a software as a service, so you pay for Alberta per patient. Last month, we started our first data services, so we are selling data without GDPR information of the patient, and we have small additional apps as marketing service. We are 100% equity funded with one business angel, Bayerische Beteiligungsgesellschaft, and myself. And with the Head Start funding, we would expand our therapy portfolio to respiratory care and oxygen therapies. For 2020, we want to acquire 2 more big customers out of the top 10, and 2021 we want to have the first results of our data. Our team consists of 8 members, including me. With 4 of them I worked together with 7 years in my last company. And that would be all. Thank you.
You have a great software product. How do you protect your know-how?
So I don't know how to answer that question because, you know, how do we protect it? Yeah, it's a software. Yeah.
Yeah, I understand, but still you don't want competitors to run into doing the same thing. So how do you make sure that you be either faster or that you have a certain advantage compared to the others trying to do that?
So first of all, we have a lot of market knowledge because we worked in the market ourselves. Secondly, we invite a lot of experts and pay for them, which normal software companies don't do in that case. So that's how we try to get ahead of the other companies.
My question would be, how do you see your software or your digital solution within the regulations in Germany, meaning telematics infrastructure and all the kind of digital interconnection plans there are?
So it takes part in the case of a patient health record. We take part in a small we have a small part in there, and we try to connect to the electronic prescription. So that's where we try to be in between.
Okay, thanks.
Nice speech, thank you. I have 2 short questions. First of all, how do you address, so for me, like chronic patients shouldn't be 82 years old. So for me, it's always the window of opportunities, the much younger population. How do you address prevention and prediction in that case? And the second question, so the challenge with the SaaS model is the usability. How do you think the 82 years old patient will use your software? Thank you.
Yeah, sure. So second question first. So the software isn't used by the patients. It's used by healthcare professionals. Yeah, they have to communicate with the patient. Yeah, okay. So we have a really good onboarding system. So to learn the whole of Alberta, you only need a half a day. But it's really good for a software in the medical field. And the first question, so we are always comparing patients to one another. So we can, for example, get faster wound healing, but prevention is pretty hard with someone who's already chronically ill, because he has the sickness already. So we try to cut off the time for his sickness sometimes, but it's not always possible because some of them are dying. Yeah.
Two short questions. First, how do you interfere with the payment models? So the payment of the doctors, for example, the remuneration model. And second, what is the source of information you feed into your system?
So right now, the companies pay us that are using our system. So we don't interfere with the payment of the doctor. So they have to pay us. And we have different data sources. One of them is from a big pharmacy organization where we get our medical data. And then there are other companies where we buy data from.
Looked at how this would work in different market settings, different healthcare systems?
Yeah, we already looked at that because since two of our customers are really big and don't only work in Germany, they work in the whole of Europe, they made a study with us. So we can use most of our software and most of our algorithms, but since the health insurance system is really different between the countries, we would have to adapt that, at least.
And you're recommending therapy
Yeah.
for the patient. How have you validated that your therapy recommendation is actually beneficial?
So we don't have our own doctors. We have doctors we pay for, and they have a look at that and give us recommendations and check for whether our recommendations are compliant.
Yeah, maybe I missed that. I saw your funding needs, but how does the EIT Health Grant then make a difference, or is there any specific purpose you're planning to address with the EIT Health Grant?
Yeah, we see a really interesting market in respiratory care and oxygen therapy, and that would be the next where we want to go.